Domestic and family violence has been a plague on Australian communities since the first battered women's shelter was introduced in the 1970s. According to the Australian Institute of Health and Welfare, 1 woman a week and 1 man a month lost their lives at the hands of their spouse or partner in 2012 to 2014. Reported incidences of domestic and family violence in 2013 to 2014 in Queensland was 66,000 or 180 calls for help every single day, with 1 in 6 women experiencing violence at the hands of their spouse or partner. Paramedics have an extremely important role as first contact for many assaults or injured patients, and the responsibility falls on all ambulatory care to identify trends and to help the most vulnerable in our community.
Despite no formal processes or laws surrounding the ambulance service response to domestic violence specifically, under Section 38 of the Ambulance Service Act 1991, paramedics have the responsibility to protect persons from any danger or potential danger associated with an emergency situation. Therefore, if a victim of domestic violence is identified by paramedics, they have the responsibility to act and care for them in whichever way possible. The clinical response to domestic violence by paramedics in Australia includes 1. The recognition of domestic violence or domestic violence risk factors, which paramedics have the increased ability to identify as they see their patients in their home environments. 2. Responding to the identified domestic violence by providing emotional support, believing the patient's claims, and assessing the level of risk. 3. Referring the patient to available services, either transportation to hospital with their consent or referral to available information, such as DV Connect or Lifeline, if they do not consent to being transported to hospital. 4. Reporting suspected or actual domestic violence to the relevant state's police service. In addition, under Section 13E of the Child Protection Act 1999, paramedics are not actually mandated to report identified child domestic abuse. However, they are still encouraged to inform the Chief Executive on any situations where it is suspected that a child may need protection under Section 13A of the Child Protection Act 1999. And 5. Documenting all relevant assessment findings.
Domestic violence contributes significantly to the health system as well as having significant social implications, and therefore the way it is approached needs to be reconsidered if the problem is going to be reduced. The impact of domestic violence cannot be understated, with domestic violence contributing to more burden of disease for women aged 25 to 44 than any other risk factor. Additionally, a study conducted by the Australian Institute of Criminology found that the incidence of domestic violence either increased or escalated since the start of the COVID-19 pandemic. This illustrates that domestic violence is still as prevalent as ever, and therefore the approach to handle domestic violence needs to be reshaped. Furthermore, the financial cost of domestic violence must also be discussed. In 2015-16, the financial cost of domestic violence was estimated to be $22 billion, potentially rising to $26 billion when accounting for Indigenous populations. Overall, the current approach of domestic violence is not reducing the incidence of violence or the cost, and therefore the approach needs to be reconsidered.
Extensive clinical training is the backbone of paramedicine. However, there is not enough training focusing on domestic and family violence. A new approach to these issues incorporates formal training on identification of family violence situations, as well as giving advice on how to safely and effectively manage them. This new response also needs to incorporate other allied health professionals to be a part of the team as first responders, particularly as paramedics have the duty to refer patients to appropriate health services. For example, having a social worker on call with paramedics to identify and support the vulnerable patients of domestic violence is a great way to strengthen the healthcare system's management of domestic violence victims. This can also open up opportunities to connect the victim into groups and resources available in the community.
While the main focus should be on the victims of domestic violence, paramedics also have a duty of care to set in motion the services needed to connect the perpetrator to a wider support system. The Domestic and Violence Family Protection Act 2012 states, perpetrators of domestic violence should be held accountable for their use of violence and provided with an opportunity to change. Having local partnerships and connections is referred to as providing a web of accountability for perpetrators, and as paramedics are often the only healthcare professional on scene, they owe it to both the victim and perpetrator to allow them the opportunity to rehabilitate. Paramedics have access to rehabilitation programs and case management services, and studies have shown that early intervention and facilitators of these programs making an effort to reach out can significantly lower the chance of reoffending.
Despite the proposed paramedic-focused response to domestic violence being a time and resource-intensive venture, this altered approach will be beneficial in the long run. By increasing support for both victims and perpetrators, and by encouraging interprofessional collaboration with first responders, the financial burden on the health system will be significantly lightened. The primary goal of this new approach is to ensure victims of domestic violence are able to easily access help through paramedics who have participated in the improved training that helps them detect potential and actual domestic violence cases, as well as effectively utilising other professional resources. Another aspect of this approach is to assist the perpetrators of the offences in receiving the required help. By addressing the root of the problem, the prevalence of domestic violence within the community should decrease, further reducing the number of victims and the stress these cases put on the entire health system. This approach is future-orientated and will greatly benefit the healthcare system in the long term.
Domestic violence costs approximately $2.7 to $3.2 billion in Queensland annually, placing significant stress on the healthcare system. Increasing formal training and taking a multi-allied approach is a strategy that will come at a cost initially. However, long-term, this strategy will have great benefit to society and paramedic management of domestic violence patients. Expanding formal training for paramedics will further educate them on identifying domestic violence and equipping them with management strategies such as knowing available services to connect individuals to the community, which, in turn, will reduce stress on the healthcare system. In conjunction with having a collaborative approach with other relevant health professionals will allow for different insights and management strategies, leading to the formation of an appropriate response and management plan. Such strategies, despite the large upfront cost, have long-term benefits that outweigh the initial cost. Collaborative practice and management within health professions will be strengthened by providing a multi-practice approach, such as having on-call social workers. This approach will benefit the community as paramedics can educate not only domestic violence patients, but also the community as a whole, connecting them to vital services to receive individualised strategies and management.